Psychological changes during the pregnancy. Pregnancy includes a significant psychological changes across the multiple organ system to support the fetal development and the maternal adaptation. Cardiovascular system increased cardiac output to meet the fetal demands. Increased blood volume leading to the hemodilution, physiological anemia. Decreased systemic vascular resistance due to the progesterone causing the vasodilation. Blood pressure decreases in the second trimester but returns to normal by term. Increased heart rate by 10 to 15 bpm. Supine hypertension syndrome, uterus compresses the inferior vena cava, reducing the venous return. Hematological system. Plasma volume increases, relative dilutional anemia. Increased red blood cell count but less than plasma expansion. Increased clotting factors, hypercoagulopathy, risk of DVT or PE. Decreased fibrinolysis enhances the clot stability. Respiratory system. Increased tidal volume, increased oxygen intake. Decreased functional residual capacity due to the diaphragmatic elevation. And respiratory alkalosis. PaCO2 decreases, pH increases slightly. Enhances the fetal CO2 removal. Increased minute ventilation due to the progesterone. Renal system. Increased renal plasma flow. Enhanced clearance. Increased glomerular filtration rate. Lower serum creatinine and the urea. Mild glycosuria and the proteinuria are normal due to the increased filtration. Dilated uterus due to the progesterone. Risk of the urinary stasis and uterism. Endocrine system HCG, human chronic gonadotropin, maintains a corpus luteum and the progesterone production. Increased estrogen, uterine growth, breast development and the cardiovascular changes. Increased progesterone relaxes the smooth muscle causing the vasodilation. It decreased SPR and the GI motility reduction. Increased insulin resistance due to the human placental lactogen predisposing to the gestational diabetes. Gastrointestinal system, delayed gastric emptying and reduced motility. Constipation, reflux, increased gallstone risk due to the slowed gallbladder emptying. Nausea and vomiting, morning sickness due to the increased HCG levels usually resolves by 12 to 16 weeks. Musculoskeletal system, increased ligament laxity due to the relaxin and the progesterone. Lumbar lordosis, back pain, widening of the pubic symphysis for the delivery preparation. Immune system, mild immunosuppression to prevent the fetal rejection. Increased risk of infections, candidiasis. Cardiac output increases by 30 to 50%. HR increases by 10 to 15 bpm. Plasma volume expands more than RBC mass. Psychological anemia. Hypercoagulable state. Increased clotting factors. Risk of DVT, PE. Respiratory alkalosis facilitates the fetal CO2 removal. GFR increases. Decreased serum creatinine and the urea. Increased insulin resistance due to the HPL. Risk of gestational diabetes. Progesterone relaxes the smooth muscle, jet, constipation, urinary stasis. Relaxin and the progesterone increase the ligament laxity, back pain and the pubic symphysis widening. Mild immunosuppression leads to the increased risk of infection.